Dr. Meera Narasimhan is incredibly accomplished. She is chairman and professor of neuropsychiatry at the University of South Carolina. She is associate provost of health sciences at the University of South Carolina. Please welcome Dr. Narasimhan.
Sairam to my Sai family. And it's a daunting task to follow a neurosurgeon, but at least we are in the same organ system here. It's truly a blessing, His infinite grace and love, to be able to have this opportunity to present in front of such an august group of healthcare providers from all across the globe about my passion for mental health, kind of the spirit of service and devotion that Swami kind of, gets us all into, in terms of trying to, in the context of Sai ideal healthcare. So hopefully, by the end of this talk, unlike the Egyptians that you mentioned, Swami will allow me to make a case for the importance of the human brain, its connectivity to the heart and the rest of the organ systems. Here are my disclosures. So what I'll do throughout this talk is try to kind of look at what we in modern medicine understand through science about disease, health, and wellness, and what the pearls of wisdom that Swami has laid out in terms of his teachings, in terms of the way that he has led by example, and how do we make sense of it all as we try to provide to the world the ideal healthcare. So if you look at the World Health Organization, we've kind of looked at this particular slide that many of our presenters presented over the last day or two. But what is important is to pay attention to when we talk about health in the context of mental health, it's not just the lack of disease or infirmity, it's mental well-being that the World Health Organization talks about. And so it's just not talking about mental disorders, infirmity, disability, but much, much beyond that. And that's where kind of Swami's teachings truly help us in being able to look at it more from kind of, what does Sai ideal health need to look at? So when Swami talks about universal healthcare, provision of healthcare across the board, how do we start to break silos that do exist in our current healthcare system? Very often we focus on our particular specialty or organ systems. And again, I know it's worldwide, especially in the United States, as we are trying to look at kind of our healthcare systems, how do we work more towards interdisciplinary, multidisciplinary teams in trying to address some of these issues as a whole for our patients. Of course, provision of free healthcare, and I'll give you an example towards the very end, talking about how do we start to make some of what Swami has already led by example, making it feasible through our super specialty hospital medical camps that he has been able to kind of, run through various devotees, to be able to translate that into action. Of course, humanism in medicine is an important element that we all need to focus on, and we have started incorporating a lot of that into some of what we talked about in the medical education and curriculum already. And I think it's also about kind of how do we bring about compassion, love, respect for one another, also about kind of serving with dignity in terms of how do we make sure that the patient is well cared for, putting yourself in their shoe. My focus for this talk will be on comprehensive healthcare, trying to look at the mind-body-spirit connectivity, and I think that's extremely important. I hope I'll be able to make a case for that by the end of this presentation. And of course, preventive health, which I think is extremely important, not just in the sense of maintaining health once we have treated the disease, but also in terms of mental health literacy. How do we go on to address and increase public awareness among individuals that we end up treating about the stigma that exists, clearly when it comes to addressing mental health problems? And of course, provision of immediate health care at the doorstep of our patients who are in distress, using love and compassion, using technologies. So the Eastern philosophy has paid a great deal of attention to the mind, body, spirit connect. So they're all interconnected, these pillars. But again, when they are out of sync, they are in disequilibrium, that's when you have dis-ease, not being at ease. And again, as healthcare providers, I think we've not done a very good job in terms of trying to understand this connect and about kind of working together along with the spirituality component of it, alternative complementary medicine. I think there's a lot, the movement has begun, and Swami truly has showed us the way to be able to bring it all together as we start to kind of, make these connections to be able to deliver ideal healthcare. Swami often talks about mental purity in the three gunas, sattva, rajas, and tamas. So when you talk about this, he also talks about mental purity and its relatedness to food purity. And when we talk about food, it's not food in the strictest of sense, not what we ingest. It is what the feeds that we end up getting through our panchendriyas, the five senses. What do we hear? Things that are unpleasant that we end up hearing, or something traumatic that we end up seeing on the television or witnessing. Olfactory kind of perceptions, tactile perceptions, gustatory perceptions. So all of these do play a role in how we process information, which then results in kind of it affecting our mental and physical well-being, so to speak. How do we understand it from a modern science perspective? We often talk about the gene-environment interaction, right? So you have environmental factors, toxins, for example, or kind of the environment in which they were raised, stressors in one's life, stressful life events. How does that gene-environment interaction result in culmination of disease? So most of what we see today is, as a consequence of this, are lifestyle diseases. So if you look at Darwin's theory of evolution today, we are becoming a fat, dyslipidemic, diabetic, depressed society. So to me, no matter which illness you pick from this slide, diabetes, heart disease, cancer, depression, anxiety, all of these are on the rise across the globe. And there is a great deal of interconnectedness between these illnesses, whether we talk about kind of physical illnesses or mental illnesses. Let me kind of give you a sense of what is the scope of the problem that we are trying to address. Across the globe, 1 in 4 individuals do experience a mental illness in a given year. Those are staggering numbers. 330 million individuals all across the globe suffer from depression. 10 million suicidal attempts across the globe, with about 900,000 suicide completions in a given year. It's one life too many to be lost. And hence, we really need to start to address this together collectively as humans. Now, the World Health Organization, we were talking yesterday about communicable, non-communicable disease, with the rise in non-communicable diseases. If you look at the Western world, depression already is the second leading public health concern. But by 2030, look at what happens. It surpasses heart disease. So to me, each one of you here, irrespective of what your specialty is, need to be in a position to effectively screen patients for depression, to be able to treat that, because it clearly has a bearing on other bodily functions. When one looks at mental illnesses, and this slide clearly goes on to demonstrate affective disorders, the prevalence of physical illness in those with affective disorders. Whether you look at depression is a great example. Depression, cardiovascular disease, right? Post-MI, the rates are anywhere from 25 to 50%. Cancer and depression, very strong links. If you look at Parkinson's disease and depression, I can kind of keep naming diabetes, about 27% of individuals, the rates of prevalence. Hypothyroidism, you name it, it's kind of across the board. And I think we really need to be prudent in how we go on to render clinical care as we start to look at an individual as a whole, because each of these has a detriment. If you don't treat the depression, how are they going to be compliant to a diabetes regimen? So I think it's important to be able to focus on some of that moving forward. If you look at the standardized mortality ratios for those with unipolar and bipolar depression, it's about 2-fold higher compared to the general population. And this is predominantly due to endocrine disorders, cerebrovascular and cardiovascular disorders. Patient with schizophrenia has a 2-fold increased risk for dyslipidemias, a 2-fold increased risk for diabetes, 2-fold increased risk for hypertension, 3-fold increased risk for smoking. So if you have all of these risks, their cardiovascular morbidity mortality risk goes up anywhere from 10 to 14 times, and hence a shorter life expectancy. So let me try to use depression and cardiovascular disease as a prototype to kind of impress upon you the need for this mind-body-spirit connectivity. There are increased rates of depression in those with ischemic heart disease. Depression is a risk factor for morbidity mortality post-MI. Now, there have been studies which have gone on to demonstrate that if you were depressed, and they follow this cohort for about 4 years, and they found out that they were at a higher risk for coronary artery disease. So there is a bidirectional relationship between the two. What came first, the chicken or the egg? Depression is also associated with increased platelet activation, platelet reactivity. So very often when I joke with my cardiology colleagues, I often tell them, you treat heartache, I treat heartbreak, we need to work together. Swami often talks about hurry, worry, and curry, right? So that has implications in cardiovascular disease, but it also has implications in mental illness. So here is a wonderful kind of example of that. So to me, as a neuroscientist, where is the evidence? Show me the evidence. And here is you're looking at the HPA axis. So constantly being bombarded by stressful life events activates the hypothalamus, which secretes corticotrophin-releasing factor, which acts on the pituitary gland to release ACTH. ACTH then acts on the adrenal gland to release cortisol and catecholamines. Now, this has bearing not only on depression and PTSD, but also has bearing on atherosclerotic lesions, ventricular arrhythmias, myocardial ischemia. So what you see here is a story developing in how one affects the other. And I think that's important for us to understand as we start to look at treatment interventions, of course, being more of a holistic approach to treating these illnesses. So one might ask, what is really treatments? What do they do for depression? And when you look at treatments for depression, so we know that in folks with depression, given what we just talked about, the neuroendocrine, the neurobiological implications, you have significant loss of neurons. People have memory problems like loss of neurons within the hippocampus, which results in that. So with treatment, so you have neuronal loss in certain regions of the brain. With treatment, be it antidepressants, be it psychotherapy, be it spirituality in the form of meditation, exercise, all of these do go on to not just kind of increase neurotransmitters at the cell surface, dampen the neuroendocrine response that we see, but they also have some downstream effects in terms of second, third, and fourth messenger systems, increasing neurogenesis. You know, when you do exercise, you feel good because you have an increase in vascular endothelial growth factor, VEGF. VEGF then triggers BDNF, which is brain-derived neurotrophic factor. And all of this then results in gene transcriptional changes. When you have gene transcriptional changes taking place, that in turn results in disease modification. Disease modification results in alleviation of symptoms of depression. So again, what you really are looking at is no matter which illness you kind of touch upon, with these treatment interventions, with spirituality being a core component of it, it truly helps in regenerating neurons. Who would have thought, 50 years ago, the brain had the ability to regenerate? And there has been sufficient evidence which clearly goes on to demonstrate that. So I think today's clinical practice, it would be prudent for us to start to work together as we start to look at Sai Ideal Healthcare in being able to kind of look at this mind, body, spirit integrative approaches to treatment, wherein a spiritual counselor needs to be a core part and parcel of treatment interventions that we render. Let me now shift gears and talk a little bit about preventative care. And when we talk about preventative care, I think despite all the progress that we have made in the 21st century in understanding the neurobiological underpinnings of mental illnesses, as well as an extensive armamentarium of medications, we have more than 30 antidepressants that are out there that are available, yet we continue to grapple with stigma. So to me, how do we destigmatize mental illnesses? And to me, the first step is in terms of literacy, mental health literacy. How do we educate one another, providers? How do we make people more aware of this is a brain disorder which clearly needs to be treated and addressed? In addition, once a patient gets to be well, what is it that we need to focus on? Here is a prescription for resilience. So focusing on positive attitude, having a good role model is very important. Cognitive flexibility, having a moral compass which truly focuses on core beliefs, faith, altruism. And a lot of that is taught within the Sai family. And Swami has truly led the way in teaching us a lot about this, coping skills that truly help us in terms of improving our resilience for reducing vulnerability. And of course, all of this ties into physical well-being. I'm going to focus the next few minutes on trying to look at kind of how do we innovate to integrate. Now, the Lord has endowed human beings with intellect. To me, how do you start to think outside the box and being creative? And it's only when you have challenges that you also start to look at how do we go about addressing it, and the opportunities emerge. And that, to me, truly has been something that Sai has taught us along the way. We were faced with a situation in the late 2000s, wherein we had, with the economic recession, the Department of Mental Health, which runs the state hospitals. So we had, because of economic restraint, we had to kind of, cut down the number of beds within state hospitals. And as a consequence, a number of these patients ended up going to the emergency rooms. So there was a significant outcry by folks within CEOs of hospital systems. How do we go about addressing this? And that's what resulted in out-of-box thinking, in trying to bring people together. The public sector, the private sector. South Carolina has about 64 hospitals in our state, and then academia. We work together in trying to look at technology, telehealth, as a means of delivering care within the emergency rooms in the state of South Carolina. We were also fortunate enough to have the National Institutes of Health, and more recently PICORI, which is the Patient-Centered Outcomes Research Institute, be able to fund us to look at scientifically and systematically measuring these outcomes. So we've seen about 35,000 patients across the board over the last several years. And these are, some of them clearly are indigent, which fits into the kind of the free care that is a part of Sai healthcare here. Universal care, parity for mental health being provided. Compassionate care, and there have been numerous instances wherein patients really have that therapeutic alliance, that connectivity with the patient, despite the fact that they're separated by distance, as well as by a screen that separates the two. And of course, all of this has resulted in us being able to demonstrate shorter lengths of stay within the hospital systems, threefold increase follow-up rates out in the community, which I think is important. How do you not make them come back to the hospitals? And then, of course, the cost savings. It's about $1,800 cost saving per patient, with about 35,000 patients already being seen. Enormous cost savings for the state. We've been able to kind of get stakeholders from across the board to be able to be a part of this project. And this includes payers, because it is important for us, as we are trying to look at provision of healthcare for the uninsured, indigent, we also need to have kind of, the payers, the insurers, be a part of this. So it's just been a phenomenal experience to take it from there and scale it to other specialties, not just in psychiatry. We have it in OBGYN, pediatrics, ID, infectious disease, hepatitis C, HIV. So to me, it was also important for us to be able to, not just from rural South Carolina, how do we then take it to India? Very fortunate to have a dear colleague of mine based out of Tamil Nadu, from Madurai, who clearly has been a champion. So we ended up getting Hewlett Packard as a part of their corporate social responsibility to work with us and providing us a mobile van to kind of go through rural counties in villages in India. And just to give you a sense of the disproportion of kind of providers to patient ratio, in the United States, in the state of South Carolina, it's about 10 to 12 per 100,000 psychiatrists. In India, it's 6,000 psychiatrists for a little over 1 billion lives. Just talk about how do we go about addressing this problem, which World Health Organization says we are the second leading public health concern. Depression is the second leading public health concern. How do we go about doing it? We really have to be creative. And that's what Swami talks about in terms of, clearly he's endowed us with this intellect to be able to be creative. And there are no limits. We've been able to incorporate ultrasounds, V-scans. You can have somebody who is trained in V-scan in rural counties. You could have a pediatric cardiologists kind of listening in on our side to be able to make some of this and translate that into action. So it's just been incredible service being done by our colleagues in Tamil Nadu, in the Ramanathapuram district. They see about 250 patients per month, and they've been doing it since 2013. So truly, Swami has opened vistas to us in terms of the way in which we connect with people, the way in which we can bring people together, various stakeholders, and how do we work towards a common goal. Alone we can do little, together we can do much. And I think it's kind of, we've been able to bridge policy, practice, and research through all of this. So when we talk about kind of Sai ideal healthcare, Swami's the 5 principles have truly redefined modern healthcare as such. Swami has led by example. If you look at the various initiatives, educating people about health issues, that connects to Medicare, which we just talked about, the ideal healthcare, which then has implications on social care. This is a great slide, which clearly gives you an analogy of the health and well-being of a human being to the health and well-being of our society. If the cells are in harmony, they constitute an organ being in harmony, organ systems being in harmony, kind of the body functions well. And if you look at an individual in harmony, these individuals can be productive kind of, contributors to the community, which then the community gets to be in harmony, which then translates into the society being in harmony. And these are immense pearls of wisdom that Swami has truly taught us. I'll end with this last slide. Clearly, we heard this beautiful rendition of Neelamegha Shyamala this morning. Sai Krishna in the Dwapara Yuga was the greatest psychotherapist counselor and who has taught us the Bhagavad Gita. In the Kali Yuga, Sai Krishna, or Swami, has truly been able to kind of lead by example. He has taught us to serve with love. He has taught us with love, man is God. And he has truly been a beacon who has continued to inspire us to be better and hopefully someday ideal human beings within the healthcare realm, to be ideal providers, at some points in our lives, ideal patients, to be able to kind of work towards this legacy of ideal healthcare. Om Shri Sai Ram. Thanks.